everyone. Thanks so much for joining us for part 2 of our 2-part session on the SNAP-Ed Evaluation Framework. We have a very exciting lineup for this afternoon. So what we're going to do is go into more detail into some of the specific indicators within the SNAP-Ed Evaluation Framework. So we're going to start with some spotlights related to assessing readiness and need within SNAP-Ed and related low-income nutrition education and obesity prevention programs. We're going to hear from California about ways that they're measuring priority indicators in SNAP-Ed. And then we'll hear from Utah to understand their experience in using the SNAP-Ed Evaluation Framework. After we hear from our presenters, we're going to do a one-on-one where you'll have the opportunity to ask questions. And then we're going to wrap up today with some announcements for upcoming events and also share resources. As a reminder, if you have any questions for our speakers throughout the presentations today, please feel free to write in your question directly into the chat box on the right side of your screen. And if you have any technical assistance issues, please also feel free to write that in directly into the chat box. If you have any trouble logging into the webinar but can hear us on the phone, please send an email to NCOR, that's NCCOR, at FHI360.org. And the team will work with you to resolve your problem to help you get onto the webinar. And one more important technical note, if you've decided to listen to the webinar today using your computer speakers, please make sure to turn down or mute your computer microphone. This will help to reduce any background noise and provide a pleasant listening experience for everyone. We also are going to be live tweeting during today's webinar, which is very exciting. So we do encourage you, if you're on social media, to join the conversation by using the hashtag #ConnectExplore and to follow the Twitter handle @NCOR. For today's speakers, we have a really exciting lineup of experts and practitioners from across the country. So again, this is Andy Najaris. I'm the Chief of the Program Integrity Branch with the USDA Food and Nutrition Service Western Region. I'm joined by Jeannie Butel, who is a junior researcher with the Regional Nutrition Education Center of Excellence, Policy Systems and Environmental Change Center that's based at the University of Tennessee, but has a national network of partners. And Jeannie is also with the Children's Healthy Living Project at the University of Hawaii at Mānoa. We're also joined by Dr. Lauren McKenzie Whetstone. Lauren is a project scientist at the University of California Nutrition Policy Institute in the Nutrition Education and Obesity Prevention Evaluation Unit. And we have Heidi LeBlanc. Heidi is the Director of Food Sense at Utah State University. So we want to see who's on the line for today and to find out how many people are joining us from the previous webinar. So we're going to start things off. We're going to open with a brief poll. So can you please let us know whether or not you attended the first SNAP-Ed Evaluation Framework webinar on August 18th. We want to see who came back for more. Great, so it's looking like so far about 64% of participants were here for the first poll, so it's welcome back. We have some newcomers as well, so thanks for joining for today to learn more about the SNAP-Ed Evaluation Framework. As a reminder, if you missed the previous webinar on August 18th, or if you'd like a refresher, the webinar recording and slides are available on the NCOR website. On the first webinar session on August 18th, we spent some time walking through the overall SNAP-Ed Evaluation Framework, our logic model with 51 indicators for change for measuring success in low-income nutrition education and obesity prevention programs. We talked about the overall use of the framework, kind of more at a bigger picture level, and heard from Arizona, the Arizona Nutrition Network, and specifically the University of Arizona, to discuss ways that they've developed statewide systems for planning and monitoring and evaluating their program success in SNAP-Ed. For today, we're going to provide more detail on some specific indicators that the Food and Nutrition Service has identified as priority indicators. So you can see these circled here. Some of the indicators are at the medium-term level of the individual level of the framework, where we're looking at changes among program participants in direct and series-based nutrition education and physical activity promotion programs. We're also going to look at changes at the environmental settings level. Again, these are the sites and organizations where people live, learn, work, play, and shop. And then we're also going to look at multi-sector partnerships and planning. And this is particularly related to when you have multiple different agencies representing different sectors, government, nonprofit, agriculture, business, healthcare, and so forth, working to collectively impact the conditions that are likely to lead to improved access to healthy places to eat, as well as improved access to places to be physically active. And then we're going to also hear about ways to measure improvements in the low-income population's achievement of fruit and vegetable consumption according to the Dietary Guidelines for Americans, the most recent version that was released. What we heard on the last webinar is that there's a 9-step process for using the interpretive guide that explains how you can use the evaluation framework for choosing indicators, as well as identifying specific tools and measures. For today, we're going to focus on step 4 of that 9-step process, which focuses on developing a set of criteria for selecting indicators for your state or local project. Again, 51 indicators is a long list of different indicators to choose from. So it's very important that states, Indian tribal organizations, territories, and related partners are able to identify which types of indicators are most useful for continuous program improvement and which indicators are priority for funders and stakeholders. So we're going to hear about 7 priority indicators identified by the Food and Nutrition Service for federal fiscal year 2017 to be used for essential reporting within SNAP-Ed and related nutrition education and obesity prevention programs. And we'll hear the speakers go into more detail about these. Before we turn it over to our first speaker, it's important to understand some key terms. We talked about the language of the framework, the language of SNAP-Ed evaluation. So we're going to hear from our speakers who are going to differentiate between adoption of a policy, systems, or environmental change when one or more change is made in writing or practice, as well as full-scale implementation to the degree to which a multi-component, multi-level intervention was delivered with fidelity, as well as the number of SNAP-Ed eligibles, or those who are low income, who are potentially impacted by the change. We're also going to hear about changes in settings, sites, organizations, and also changes that are influenced by partners, sectors, and systems. So without further ado, I'd like to introduce Jeannie Butel from the University of Hawaii at Manoa, who's going to talk about readiness and need assessment for SNAP-Ed. Jeannie.
All right, thank you, Andy. As Andy said, I'm Jeannie Butel from the University of Hawaii, and today I'm going to be focusing on the needs, readiness and needs assessment flowchart for SNAP-Ed that's in the interpretive guide. And I'm presenting today on behalf of the PSE Change Center. So a little bit about me is for the last 4 years I've been part of a large USDA grant that is based at the University of Hawaii at Manoa, but we work throughout the American Affiliated Pacific from Alaska to American Samoa, Guam, CNMI, and Hawaii. And as you can see by this slide that we work with a variety of partners and collaborated with a variety of groups of people. So that's where the reference where I'm coming from today, and I will be using examples from the CHILL program, as we call it, to go through the flow chart. So, I'm working with this is a product of the Policy Systems and Environmental Change Center based at the University of Tennessee. This is our goals and objectives. And today, though, I'm really going to be focusing on the second one, which is the readiness to change and best practices and how that can help SNAP-Ed agencies implement PSE changes. So as Andy said, this really does go into the ST5, ST6, and ST7 of the organizational motivators in the SNAP-Ed framework. In particular, though, I will be speaking to the Readiness and Needs Assessment it's on page 85 of the interpretive guide, or it starts there. But it does branch over into the champions, which is ST6, and organizational partners, which is ST7. So why would you really want to do a readiness assessment? It's really because, as we all know, relationships and communities are not static, they're dynamic, and it kind of is more of a continuum. So it's a process to develop partnerships and to evaluate partnerships. It can provide tools to measure the readiness to make this change, and then it can help identify partners to move things and to implement PSE changes. So looking at readiness and needs, we're page 85 of the interpretive guide really kind of gives you a good background on what it is and why we're doing it, etc. But today I'm really going to be focusing on page 86, which is the needs, readiness and needs flow chart. As you see, it starts in the upper left-hand corner, and it asks a question, and based upon the response, you either go, if it's a yes, you go down to the next question. If it's a no, you can go over to the right side, where it will tell you some idea of what you can do to address that, and gives you some tools that can be found in the interpretive guide to help you address that and move you forward in the readiness process. So it really is a stepwise approach to implement it. It helps indicate where you can focus your efforts for the year. It provides the links and to resources, and the links are really based on the need for readiness. So it's not like we're looking at something, we're telling you to run a marathon and you've been sitting on the couch for 3 months. It gives you where they're at and where your group is at to help move forward in readiness and to implement PSE. So I'm going to be using examples to kind of help walk through this flow chart using CHILL. An example, I have 2 different examples from the Children's Healthy Living Program. And the first one, in CHILL, one of our things is we really wanted to have a coalition for sustainability of our program. We wanted coalitions of partners with the community-based organizations to focus on improving physical activity and nutrition in the environment. So that was one of our intervention strategies. So this first example is going to talk us through the first half of the flow chart. With number 1, question, has this needs assessment been completed? Was there a coalition representing it? And the opinions of the perspectives of the core coalition well and clearly established. So these are what we're going to be focused on as I go through this example. So this was an example that we used in Saipan, which is in the Consolidated Northern Marianas Islands. We did more than just a walkability. We did an entire assessment of the food and physical activity environment. But for this example, I'm just going to use walkability. So we did do the walkability checklist on safe routes to school. So on the guide, if you look, you can go to page 90, and it will tell you what some examples or tools you can use. So we went to page 90. If we go to page 90, you'll see that there's the walkability checklist. So what we did is we conducted it. We are a randomized control study, so we conducted it, but we had one CHILL staff member do it, but we also had either a community partner help us as well. And so we found someone, either it was from a PTA or a school program, that help us do the walkability assessment because they are the experts in their community. They know what to do more than us and give a more rich assessment. So we found out, we did that, and yes, there was a need to improve walking, not only walking, but the food and nutrition environment in the community. But then we went down, so we go down to the second question is there a coalition representing the SNAP-Ed approach? Well, looking over, no, there wasn't. So it says consider building a network before you do a formal assessment. And it gives you the tools and resources sections, ST6, 7, and 8. So looking at this, what CNMI did is first of all, we didn't have this guide, but we looked for champions, or as we call them, role models in our communities, which really does fit into resources for champions, which is can be found on page 95. So if you'll see the red box, looking at the Center for Collaborative Planning, if you go to that website, you can go to their resource library and then their community building, and the community toolbox right there from the University of Kansas can give you some guidance on how to engage people in community work and find community champions. What we did is we identified them by asking people that helped us and worked at it. Oh, sorry, I went ahead too fine. And we trained these people. We had a training with them. We engaged them in the process. We basically taught them effective communication skills, and then brought them together by having a project they did together, which was design a logo for their community. And that really brought them together. And amazingly enough, we'll go down to sample 3. I'm sorry, I flipped too quickly through my slide. Once we got that, they established a coalition really quickly, but they obviously were new, so their opinions and perspectives were not real clearly established. And so from here, you can really go into using a facilitated discussion with the leaders or using the readiness tool. The ORIC is there for you to use for that coalition or that group if you want. We didn't have that tool at the time, so what we did is we helped facilitate them by helping them establish priorities, kind of being a backbone organization, conducting meetings, and sending out minutes, et cetera, so they could get their perspectives clear. So that was how that one was done. Our second example that we did was based in Hawaii in our community in Waianae. They already had a coalition of partners that were really focusing already on wellness and place-based learning. They had a lead, and we just wanted to see what we could do to add to that partnership. And so that would take us down to the lower half of the flow chart, and you'll see the things 4, 5, and 6 questions. So were the opinions known to a broader group? Were they supported by the community? And if there was a wealth of information already used in the community. So the examples and the opinions and perspectives weren't really well known of the coalition to it. So going over into our flow chart, you'll see you have another decision. Were the members willing to help? Yes, they were. So we went ahead and we gathered information. So we used a qualitative approach, which can be found on page 98. We did a review of the organizational chart and the partnership structure. So this was done not only in Nanakuli, but we also did it throughout CHIL. This was at our meeting. So we looked through how our connections were, what the strengths of the connections were, who was part of it, and who was missing. And then once we did that, we said, okay, we got this. So how are we going to get broad support for the Alliance? There wasn't a lot of broad support. So what we did is through the CHIL program, we had assessed using the CX3 all the environment, the fast food environment, the store environment, and the physical activity environment in these communities. And we summarized them into what we thought were suggestions for improvement and thoughts for next steps. And we presented that out to the community. In addition, the Alliance partners conducted a participant, for people in their programs, diabetes surveys to understand more community feedback on what they wanted and what they thought about the issue. And so we did the environmental, this is kind of the same thing again. So we then moved on to what happened from that. The resulting of that was the organization got together and we partnered together more on activities. If you look at the upper left-hand slide, it was a paint the night away. They kind of improved the school environment by making a big mural and all the people in the community painted together. We had things where had a hands-on demonstrations with partners events, had the students help us with helping prepare food and get ready for it, and had tastings at farmers markets, and had quick surveys to get people to know where the interest was throughout the community. So now the Alliance has a lot of information available to analyze and share and use for planning. So one of the things you can do is once you get this, you're kind of at the end of the readiness and flow chart, although it goes up and down, it is dynamic. Then we kind of move into short-term indicator 8. And if you go to page 147, they give you a couple of ways you can do that. Looking at the partner tool, it is a website that kind of helps you move into looking at experts that can help move and evaluate effective networks. We didn't have this at the time, but what we did, we were fortunate to be involved in a group that allowed us to look at reinforcing cycles and detrimental cycles. And we found that there are leverage points, and that is where they're at now. So how can we leverage these things to make it going on, and what can we do to mitigate the ones that were not so great? So that is what we did with this. So that kind of walks you through that flow chart. I just want to let you know that there is a readiness to collaborate assessment tool that we're working on right now that kind of helps figure out where the group is on readiness. So we're having it. The cognitive testing is beginning this fall. I'm pre-pilot testing it now with a few groups to see if it's useful and usable. And it's a short 5-question one that can help establish collaborative partnerships. And it's going to have available tools so you can plan straight from there, and it can support initiatives for the PSE change. And that's it. If you have any questions, please let me know, and I'll turn it back to Andy. Thanks.
Great. Well, thank you so much, Jeannie. And if anyone does have questions, please feel free to type those into the chat box, and we'll return to them later on in the webinar. So we heard Jeannie describe many of the essential steps that begin the PSE process. So we have to think about assessing need and readiness, identifying local champions, creating organizational partnerships. Now we're going to geographically get on the plane and fly from Hawaii over to California, and we're going to turn things over to Lauren Whetstone, who's going to talk about measuring priority indicators in California's SNAP-Ed program.
Great. Good afternoon, everyone, and thank you so much, Andy. Andy introduced you to the SNAP-Ed priority indicators, and I wanted to share a little bit with you about how we've been using the evaluation framework to guide our evaluation of SNAP-Ed-related activities in California. So before I started, though, I wanted to talk to you briefly about the structure of SNAP-Ed in California. So the California Department of Social Services receives California SNAP-Ed funding, and the California Department of Public Health, the University of California CalFresh program, the California Department of Aging, and Catholic Charities of California are the grantees who, along with CDSS, the social services, serve as the 5 implementing agencies in California. Each implementing agency funds local agencies to carry out SNAP-Ed activities. And so I just wanted to show you this so that you could see the number of agencies that are funded by each implementing agency and sort of the scope of the work that happens in California. Beginning with planning planning for 2017, the local agencies and counties in California that receive SNAP-Ed funds are working together to develop 3-year integrated work plans. And these work plans focus on local 3-year SMART objectives, and those objectives are tied to policy systems and environmental approaches. And so in addition to the agencies all working together within their counties, the evaluators from the 5 implementing agencies in California are working together and have developed common SNAP-Ed goals and objectives for the fiscal years 2017 through 2019 and are currently working on a joint evaluation plan among those 5 agencies. And this work is guided by a theory of change that group of evaluators developed. And the SNAP-Ed evaluation framework is going to be used to identify shared measurements, shared metrics that can tell a more unified story across the California SNAP-Ed implementing agencies. And this is fairly new work for us all to work together, for all of the 5 agencies to work together to develop a shared evaluation plan. I don't have a lot of time to review the theory of change model in a lot of detail, but I did want to show how the evaluation framework informed the components of our model. So there are the three SNAP-Ed approaches that you can see down there under approaches in the 5 different settings that Andy mentioned, so eat, learn, live, play, shop, and work, are proposed to produce changes at the environmental setting level. So changes such as increased access to fruits and vegetables, decreased access to sugar-sweetened foods and beverages, increased access to healthy meals and snacks, and increased access to physical activity and skills and attitudes, and to also produce behavioral changes in individuals such as increased fruit and vegetable consumption, decreased added sugar, increased dietary quality of meals and snacks, increased food resource management, and increased physical activity. In the model, these changes together will impact health outcomes and ultimate outcomes, which are the population results indicators in the framework. So today I'm going to focus mostly on the evaluation work that's specific to the California Department of Public Health as an implementing agency, and some of the work that we at the Nutrition Policy Institute are doing as part of our evaluation contract with the California Department of Public Health. And as Andy mentioned, I'm going to concentrate mainly on our experience with REACH adoption and implementation in qualified sites and organizations, but I want to briefly mention the CDPH approach for measuring individual level and some population level indicators. So for over 10 years, the California Department of Public Health has assessed behavioral change among SNAP-Ed participants who receive nutrition education. And currently, those local health departments who are under the California Department of Public Health that receive more than $350,000 in funding are required to assess changes in behavioral outcomes. So age-appropriate surveys are administered both before and after nutrition education class series. And the surveys contain questions that provide data that support the measurement of MT1, which is healthy eating behaviors, MT2, which is food resource management behaviors, and MT3, which are physical activity and reduced sedentary behaviors. So in our federal fiscal year 16, there were 44 evaluation projects in 36 counties that were conducted, and over 8,500 match surveys were completed by participants and will be analyzed. The CDPH Champions for a Healthy Change survey project began as a longitudinal survey of mothers, teenagers, and children from randomly selected SNAP households in 17 California counties. The methodology for this survey changed in 2016. The survey was expanded to 30 counties, and a new cohort was recruited only in 2016. But during the telephone interviews that happened as part of this survey, there's a lot of comprehensive information on dietary behaviors using the ASA-24, types and levels of physical activities that participants do, and self-reported height and weight that allows us to calculate BMI is collected. And these data give an indication of population level results among the SNAP-Ed cohort that's related to indicator R2, specifically changes in fruit and vegetable consumption. And just to give you a sneak peek, there's an in-press article in the Journal of Nutrition Education Behavior that highlights some of the preliminary findings from the analyses of the dietary recall, which showed that mothers from the census tracts that had higher levels of SNAP-Ed intervention reported eating more fruits and vegetables and fewer high-fat foods. So just as a sneak preview, if you're interested, that journal article will be coming out soon. So now I want to turn to our approach for measuring policy systems and environment changes in SNAP-Ed sites and organizations. And that will mainly be the environmental settings chapter of the interpretive guide. So we began collecting information on PSE changes in 2014, and our work then was guided by the Western region SNAP-Ed evaluation framework, so before it became a national framework. And the type of work, remember the type of work, PSE changes in particular, was very new to SNAP-Ed agencies. So there was a lot of need for providing technical assistance through training webinars and one-on-one support. And at the time, we developed a couple of tools which were helpful to our local health departments. One was what we called an indicator summary sheet, which outlined core and optional indicators that were from the Western region evaluation framework then, and tools for measuring them for a particular set of PSE strategies. We also developed a tool for local health departments to use to then document the indicators the core indicators that they were going to report against and measure, and the strategies that they would be using. So what tools and strategies would they be using for that? So just a way for them to keep track of the indicators they would be measuring and how they would measure those and who would do that work. To capture local health department progress on PSE changes, we developed an access reporting form using Microsoft Access that local health departments used in 2014 and 2015 for annual reporting. So on this slide, I just wanted to show the extent of changes that were reported in the 2015 report from California local health departments using the settings list from the evaluation framework. It might be too small to see all the details, but basically the dots represent all of the sites in which PSE work was conducted, and they represent are categorized by the settings from the evaluation framework. So most of the work in California in 2015 was focused on school, retail, and early care and education sites. So I mainly mentioned our 2014 and 2015 evaluation and support approaches because during those first 2 years we monitored challenges and successes and learned a lot about the complexity of measuring and reporting PSE changes. So our first access reporting form was very detailed, and we attempted to capture nearly all of the framework indicators. I think at that time there weren't 51, but there were still a lot of indicators. But it made for a very complicated form, and we had challenges around the use of Microsoft Access. Not everyone had the program. Local health departments really wanted us to work on having something that was like an ongoing tracking form. There was difficulty in ensuring the quality of the data, mainly sort of consistency across local health departments, and the difficulty in obtaining some of the outcome measures like reach and resources. Oops. Looks like I lost my screen. Okay, sorry. So I just wanted to, we were really excited then to learn about some of the work that was being done, to learn about the Program Evaluation and Reporting System, or PEARS, that is being developed by the team at the Office of Educational Innovation and Evaluation at Kansas State University. You're going to hear more about PEARS from our next presenter, but we've been working with the PEARS team to develop a PSE module that will address our main PSE reporting challenges and serve as a potential model for other states. So most of the health departments funded by CDPH and a sample of agencies from the other implementing agencies will be piloting this for 2016. So I want to share some of the practical details and support that we're providing, particularly related to adoption, MT5 and MT6, and implementation and effectiveness. Andy provided definitions of adoption and reach, but just as a reminder, adoption occurs when SNAP-Ed sites or organizations put into effect evidence-based PSE changes. There are several outcome measures, such as the number of policy, systems, and environmental changes, and the number of promotional efforts. And I just wanted to say that one of the main aims of one of the aims of the PEARS system is to serve as a learning tool. So along with data collection, the introductions to each section include important reminders about the indicator. In a special feedback webinar in which we talked to our local health departments and agencies about the components of this new reporting system, the agencies told us that they would prefer to report on their PSE work at the site level. So for adoption, agencies are going to select specific PSE changes that were made at each site at which they're working. So the list of changes will be displayed in drop-down lists that contain the nutrition changes from the interpretive guide, the framework interpretive guide, which you can see here and you guys have probably seen, so I'm not going to go over the details of those. And from physical activity and reduced sedentary behavior changes from the interpretive guide also. And again, I know that you guys probably went over these in the first webinar, so I'm not going to go into detail there. One of the most challenging outcomes to measure is potential reach. And for federal fiscal year 14 and 15, we had developed guidelines about measuring reach. And those were difficult and challenging, as reach is challenging to measure. So for right now, we're working on updating that document with more specific guidance and instructions to measure potential reach in PSE sites. And we're going to be piloting that this year along with the PEARS PSE system. And so we will be happy to share that after we get done pilot testing this guidance around reach. One of the things we're wanting to really do is to focus on getting unduplicated reach. So if multiple activities, PSE activities are happening in the same site, how do you ensure that you're only measuring folks one time? And so we'll be working on how to best get consistent information about reach. In the framework, we differentiate between adoption and implementation, and Andy mentioned that adoption, remember, occurs when PSE sites and organizations put into effect an evidence-based PSE change, and that implementation is really measured as the adoption of PSE changes along with other components, so making it a multi-component and a multi-level intervention. So for implementation, we measure the number of complementary components and the types of those components of an organization at each site or organization. So we'll be looking specifically, again, asking our local health departments and agencies to think about individual sites. So at each site, was that PSE change made in conjunction with evidence-based education, with marketing, with parent and community involvement, and with staff training? So again, this will be something that agencies mark for each site in which they're working. The last outcome measure that I want to talk today about is effectiveness. The recommended approach for measuring effectiveness of PSE change is baseline and follow-up environmental assessments. There are lots of assessment tools that are listed in the interpretive guide, and agencies will be able to select from that list in a drop-down which tool they use, and then to talk a little bit about the results of that. So if there were scores or if they had some important changes happen during the year, we anticipate that not everyone will be doing both baseline and follow-up in that first year or in this year that we're reporting, but we'll be asking folks to report both the dates that they administer their assessment tools. And I just wanted to mention that for FFY15, the top 3 tools that were used by our agencies were the Choice Toolkit and Self-Assessment Questionnaire, which assessed the environment in early care and education sites, the Communities of Excellence in Nutrition, Physical Activity, and Obesity Prevention, or CX3, and I think Jeannie just mentioned that they had also done CX3, an assessment of the food environment in neighborhoods, retail settings, fast food environment, walkability. And then also the Check for Health Worksite assessment was the third most popular assessment that was done among our agencies in California last year. These are all included as examples in the interpretive guide, and I've listed the links here in case you're interested in looking at those also. So I just want to conclude by saying that we are very excited to pilot the PEARS PSE module, or I know our agencies are looking forward to trying this new system, and we look forward to reviewing the data for 2016. It's always excited to have a new process to use, but then also exciting to think about the data that we will be receiving and preparing to report back to the USDA. For future years, one of the features that our local agencies are most thrilled about, and I mentioned earlier as a challenge, was that this will be a system that can be used for ongoing tracking. So it won't just be an annual reporting system, but will be used for ongoing tracking throughout the year, so folks can monitor how that work is doing, and we can look at that throughout the year. So we are so appreciative of the excellent work to produce the SNAP-Ed evaluation framework and the interpretive guide. I think it will play an amazing role in helping us to illuminate some of the shared outcome measures and talk about the successes of SNAP-Ed. So that is it for me. Again, if anyone has questions, please feel free to type them into the chat box.
Great. Well, thanks so much, Lauren. So you can see how we've moved from assessing readiness, champions, and partnerships towards measuring adoption of PSE changes and promotion, and then towards full-scale implementation and effectiveness. There are other resources as well as you move towards the long-term aspects of the framework, also looking at sustainability and leverage resources. Those aren't priority indicators at this time, but again, you can see the full continuum of PSE work. It's a process. It continues to have additional information and resources over time that can inform our work. And speaking of resources, many of the tools that have been mentioned to date are not only included and referenced within the SNAP-Ed evaluation framework, they're also highlighted as intervention and related resources within the SNAP-Ed strategies and interventions, the toolkit for states. So it's really important to look at the framework interpretive guide and the toolkit as companion documents. They really work hand in hand. So now we're going to hop on our bicycles and put on our helmets, and then we're going to ride over to Utah from California, and I'm going to introduce Heidi LeBlanc with the Utah State University. Heidi.
Okay, thank you very much. I'm going to talk about how we have adopted the framework and how it's laid out the work for us in Utah. In 2013-2014, when Andy and the Western region were sharing the work that they were doing on the framework, we listened. It made logical sense for us to adopt it and begin use immediately. The outline was simple, and it provided us a framework that has helped us keep our work aligned and to be able to expand the work that we're doing and to move things forward. I'm really happy to share the work that we do. I have to say that we have a very supportive state agency and regional office. They are very supportive of us following the guidelines that are given to us and for us to work towards making SNAP-Ed as a whole better. When we start planning and writing our grant, we work as a team. I have advisory council members who are our supervisors of our NEAs, and we also have a state office team, and we sit down and we talk and we really find out what FNS has written in the guidance, and when we go to ASNA, we really listen to what is said, what are the messages being said, and the framework has been a message for a few years, so it's an important piece. Our goals are reflective of that. We actually utilize the goal that FNS has written to, the Utah SNAP-Ed goal is to improve the likelihood that persons eligible for SNAP will make healthy food choices within a limited budget and choose physically active lifestyles consistent with the current dietary guidelines for Americans and the USDA food guidance. So we really try to use the language, and it simplifies our work and it makes it very straightforward for us. We've used the framework over the past few years, even before we were asked to really implement it. It has helped us, once again, to showcase our program. For example, we simplified our questions on our intent to change behavior surveys. We simplified them and took out the fruit and vegetable question. But this year in the guidance, it's very specific that they want us to ask these questions, so we have added them back in. And the framework and the interpretive guide have helped us to be able to do that. Okay, this is I'm going to cover MT1, actually ST1, MT1, LT1, and 2 and 3 for all of those, and cover the direct education, how we teach English, Spanish, refugees. We work with an intergenerational poverty group, and our direct education for youth. On the intent to change, so excuse that it says MT1, it should be ST1. On the intent to change, we ask questions on the healthy eating behaviors. We ask questions on choose whole foods based on My Plate recommendations. And now we're asking the question, increase fruit and vegetable consumption, and eating whole versus overly processed foods. On the 6-month and 1-year follow-up, the 6-month is actually on the right-hand side. I just took a screenshot of part of the evaluation, and I did it the way you can see it, so it has a question and then it says prior to food sense. So for every section of the MT1, 2, 3, or ST1, 2, 3, we broke it up into the categories. So this survey is also a retrospective prior to, it's more of a pre-post because we asked prior at the beginning. And so it shows some of the healthy eating behaviors that we are asking. And then in the 1-year follow-up, this is another survey that we do. We have them sign up and we call them and ask them the questions. Since attending food sense education, I have been following My Plate by filling half my plate with fruits and vegetables, and then they fill out on a Likert scale. So all of those surveys are on a Likert scale, and we're starting to move into LT1 with our 6-month and year follow-up, and then we also have focus group interviews, which we work with our participants to find out if they're this will be our first year of doing the focus group interviews coming up in 2017. And so these are some of the questions that we're going to ask on healthy eating behaviors. As we go into food resource management behaviors, once again, we follow the same steps, the intent to change, the 6-month, the 1-year follow-ups, and now we're doing focus groups. So in the intent to change, these are some of the questions we ask. So on the food resource management, we want to know that they're menu planning and they have safe food and they're shopping with a list, and that our curriculum set up to teach on how to cook with what you have on hand. So we talk about a well-stocked pantry or a kitchen, and then we talk about and evaluate those types of things. So here's the tool. Once again, you can see the intent to change. That's the one on the top with the boxes. And then the survey is the 6-month follow-up prior to food sense, lessons I use to, and then it helps us to see if they have enough food to last through the month. And then at the end of that survey, it's the now I am, so we get to see if they are making the changes over the 6-month and year. The next one is the focus groups. So we focus on where they're grocery shopping. We're going to ask these questions and find out how things are going for them so that we can either improve our programming or validate the work that we're doing even more. And then the ST3, MT3, and LT3, so physical activity and reduced sedentary behavior. Once again, we follow the same format. The retrospective post-pre, as you can see, it says choose to be physically active for at least 30 minutes 5 days a week. And the 6-month and 1-year follow-up asks the same question. Are you physically active? Here's the this one's actually the 1-year follow-up. During the past week, other than your job, did you participate in any physical activities such as these? And then if they answer that, then it goes to the next question. That's why I took this screenshot, so you could see that sometimes the questions add more questions as they answer. Okay, and then the focus groups, once again, we're going to ask questions on Where did you get information about nutrition and exercise? What barriers, if any, prevent you from being more active? What changes could be made in your community that would encourage people to be more active? And this, we're hoping, will also help with our PSE efforts. Okay, and some tools that we have that we can use. I'm really excited, actually. I'm a big fan of PEARS. I am probably their biggest fan. When we, many years ago, it's probably been 3 years ago, at ASNA, we talked a lot about standardizing evaluation, and that's pretty tricky to do, but I think that this is a great way that it can be in a spot where it can be seen, and it can be utilized by the local area, the state level, the county, the region, the national, and I really think it's showing some impacts on how what is happening. At least I can see that in our state. So I can look at what one of our NEAs, which once again is our educators, what one of them is doing and how their work is going. I can look at them daily, and then I can either compare to another person or another group, and just we're able to assess how they're doing and how to improve the work that they're doing, or how to improve the work that we do. So how it works in our state is we adopted it. We completely adopted it. And back in January, we started the training phases of it. And then Kim Garrity, who is our evaluation coordinator, set a date of, I believe, March 14th that we would fully implement PEARS for our direct education. And so on that day, all of our NEAs who had been extensively trained, once again, I wanted to mention that. They've also been city trained, so they all have the IRB training. And I also want to mention that they are paraprofessionals, and that they just step up and they do their job, and we ask more of them and more of them all the time, but they're happy to do it. So on that day, Kim Garrity set that date, and she shut off them from turning in paperwork to us. So they had to go on to, we had to also get them all iPads so they could enter the data themselves. So we were able to use other funding to get those for all of our educators. We got them iPads, and then we also set up, so Kim can kind of control the iPads. She can push PEARS, she can push notes out to them that says, oh, you need to report this, you need to go in and report. You haven't reported for a few days, or whatever it is. So anyway, she started that, and our NEAs have just stepped up, and we have all of our data in one location. We were able to send the first part of the year to the PEARS team, and they were able to put it in. We sent it to them in an Excel document, and they were able to put it in so that we have all of our data in the one location. Sorry, I'm jumping ahead of my own notes. I want to just show you some screenshots of those. This is some demographic data. I just wanted to show that this is the kind of stuff that you get for PEARS. It shows you real-time, everyday demographics, and I just took a couple screens so you could get a glimpse of them. If you haven't tested it out, I highly recommend it. And for this is part of our PEARS data, and it's just actually just like the PEARS group will come and tell you that it is like 3 clicks to getting the whole PEARS report. It's amazing. It's the best system that we have had along the way. And then here's just a map, and I just find this very interesting. I can't really point to it, but as you can see, the darker counties, so Salt Lake, Weber, and I've even mentioned Millard, they're the ones that are our highest producers. The white ones, we're actually missing some educators right now, so So they're kind of stagnant at this time, and some of them don't qualify at all, or such as Daggett, we only have 3 that are on SNAP-Ed, or SNAP, in that county. So Duchesne, Uinta, and Daggett include that county in for them. So they were able to reach those people because it's always important, but it's an awesome tool. So I wanted to show one thing about this. So Millard County is one educator in that big county, and Salt Lake and Weber are urban areas for our state, and they have multiple educators, and they are just a little bit darker, but only because our person in Millard County got hurt. She got in a car accident and hasn't been able to teach. So they passed her up for a minute, but that's something that we're able to show. So Salt Lake was asking for additional resources, and they do need it. But I was able to say, well, look, this one person's doing this. We need your people to step up. And so it's kind of a fun tool to look at that way as well. And here's just a couple instruments. I took some screenshots of these as well so that you could see. It's all on a Likert scale, like I showed you at the beginning, but shop with a list so you can see the improvements that our program's doing. You might wonder how our NEAs feel about giving this information or adding this, having to do this as part of their jobs now. They actually really like it. They've given us good feedback, and we've made a lot of tweaks with it, but it helps them be responsible for it, to turn it in, to make sure they're accurate. Kim validates it to make sure that they're not missing any pieces and that it's being entered correctly. And they like to see the results. They like being able to be a piece of the bigger puzzle. Okay, this is one of my very favorite parts to talk about is SNAC. And SNAC, we implemented SNAC in 2005, like all of us were challenged to do, and we kept it going the whole time. So we have never lapsed in it. We have had some bad years, some years that things weren't progressing and moving forward, but lately we've had awesome years. And I just wanted to mention that it's a great way to partner, to be able to do PSE work, to be able to showcase the work that we do. So this, on this screen, is our SNAC report, and this is our second year of the report, and I just mentioned a few things. Well, in the table of contents it says that it will cover benefits of SNAC, and then all the partners that we have that are part of SNAC, that are active participants, then are added in there, and they have a place to showcase their work. So together, it's a report that is for SNAC, but it also gives each group a place to say, this is how we're doing as an entity, and really share the results of their program. And then at the bottom, number 8 says success stories, and that's where we share the work that we do, and then 9 is the SNAC projects. So some of the work that we do as a SNAC team is we have a group called the Utah Breakfast Expansion Team. It formed because of SNAC, and Utah's number 51 in the nation for not doing breakfast in the schools. So we only could move up, and that's what we're trying to do. So we joined this group, and with the group we are trying to provide a breakfast report card about the schools and how that's working right now. We're hoping that will motivate people to improve. It will, excuse me, include ways to improve or to implement breakfast, and who to contact, that kind of stuff. And then we're also doing a parent survey data collection in Utah. And I don't know if anyone else runs across this, but we're kind of unique in the sense of we're very traditional. And we have run across, it's usually administrators saying, well, in Utah we have family values, so we make breakfast at home for our kids, and we don't need breakfast in the schools. And I think that's why we're 51. But we're trying to do the survey to say, you know what, that could have been the case in the 1950s, but I think things have changed a little bit. And with all those working mothers, we're a working poor state. With all those working mothers, we need to be able to provide breakfast in the schools or a second chance breakfast or something. So that's one of the things we're doing. The other thing that the SNAC group is doing is video and presentations that are for agencies that we work with. We're piloting one with Bear River Health Department. It just shows resources and agencies, the ones that are on the SNAC, that can provide the participants with additional tools, resources, benefits. And then another awesome piece is the farmers market outreach. We were able to be collaborators on a Finney grant that was funded, and we're in our second year of Double Up Food Bucks. So that's pretty exciting. All right, so I highlighted some of them, so I'll just briefly cover them as we're going through. So Casey Coombs, who is our PSE coordinator, has developed the Thumbs Up for Healthy Choices toolkit as well as the campaign. And so it's just a little thumb with a lot of different healthy food on it, on the thumb to make it the thumb, and it's in of our pantries. It is being piloted right now, and it's going very successful. The Utah Department of Health has adopted it, and they want to pass it to other pantries. They'll be part of the pilot project, but they've adopted it, and they are very excited about it. I mentioned the Utah Breakfast Expansion Team. We were able to get some cereal donated and go to school conferences where the label is on your left. It went onto the cereal pack, and we passed those out, as well as the poster that was there. Another work that we're doing is a social marketing campaign. It's pretty little. We're just trying out a few things this year. It's our Family Mealtime, and this is Family Mealtime Month, September. So we have developed a cookbook that, once again, the Utah Department of Health, as well as all of our SNAC team, have adopted and are passing them out to their participants as well. So it covers etiquette, table settings, easy food, SNAP-Ed recipes, talking together as your family. There's conversation starters on there, and all the recipes are very I can't think of the word, good for our participants. Here's part of the campaign. Our curriculum is called Creates. It's like create a casserole, create a meal, and so we use Creates in all of our work as well. So Create Family Mealtime, and we are having people pledge how many family meals they'll have with their family this month, and then they're able to decide how that works for them. It's been really fun to watch. It's also on our social media sites. And so that's it. Do you have any, I guess, sorry, I'll let Andy take over.
Great. Thank you so much, Heidi. It's great to hear from Heidi and the approaches in Utah. You can really see the full spectrum from measuring intentions among participants and measuring behavioral changes. And Utah's a national leader in also measuring long-term follow-up, how they've gone through and done ST1, ST2, MT1, and then LT1 as well. So really exciting. Thank you so much. So what we're going to do for the rest of our time is we're going to take 3 questions. There's lots of questions from the audience. So we're going to start with 3 of those. And then We're going to get through the rest of the slides, and at the end, if people want to stay on, we'll take some additional questions. So I'm going to start with one question for each presenter. So I'm going to start first for Jeannie. So Jeannie, how did using the partnership tool help you to decide specifically what PSE priorities the communities want to focus on and what outcomes that communities and residents would agree to work on together?
It really, Andy, what we did with that is we looked at where they were at and how they were willing to take on that activity. Did they have enough support for that activity? So what we did is we found areas where they had a lot of interest and they had a lot of ability and they had the broad-based support. For an example, looking at in the settings of this preschool, we looked at the wellness policies and wellness policy implementations. And we did focus groups with the teachers. We talked to the parents, and we found out that it was wellness that they wanted. They wanted teacher wellness that they could incorporate into the classroom. And so that's the strategy we focused on, was getting the nutritional physical activity worksite wellness basically to the preschool teachers. So that's how we decided on that strategy. That's kind of an example of how we used it.
Great. Thank you so much, Jeannie. The next question I have is for Lauren. So there's a question related to one state's asking about population indicators or population results. Their preliminary thoughts are to include the behavioral risk factor surveillance system questions in the pre and post surveys that are used during direct education programming. This would be a self-selected sample and not necessarily a representative sample of the low-income population in the state. What are your thoughts on this approach? We do have local and county level coalition data available for a few counties, but again, not statewide.
I think that's a great question, and one that we've actually been talking about, because the survey that I talked about also is not truly representative of the state. So again, it was randomly selected, people who were randomly selected within those counties, but the counties weren't randomly selected. And so while it represents the SNAP-Ed cohort that was that answered the response, that responded to the questions, it's not truly a state representative sample. So I think that, I mean, I'm not sure, and Andy, we've talked about this in groups, that all states have the resources to do a true representative sample surveillance each, annually or biannually. So I think that you could get some data, but would be able to just speak to that it that it represents and applies to that particular group of people that answered it. And I think that there are opportunities to use BRFS as questions for your, to get the state level responses for your state that could be used to also address your population indicators in your state. So you could just look at what the BRFS data are to look at the population level indicators for your state.
Great, thank you, Lauren. And then our third question is for Heidi. Heidi, can you describe for the 6-month and 1-year long-term follow-up surveys, what strategies have you used to retain participants and or track them down after such a long period of time? Have you had success with retention in that time frame?
Yes, we have on the bottom of our first evaluation that they do, we have a spot that says, please fill it, if you're willing to fill in or complete a 6-month follow-up, please fill in your email address, phone number, contact information. So they do that, and not everyone does. It's totally an optional thing. So some do it, and then in 6 months we call the person and do the survey, and then we ask them once again if you will do the follow-up. So, and then we do it again 6 months later to get our 1-year data. What other piece did I miss on that?
No, that was great. Thank you so much. And we do include more information about the approach Utah uses within the interpretive guide, so you can read more as well. So we are going to email responses to all of the questions that we didn't answer and post those answers onto the website, and this will be both for today's webinar as well as the August 18th webinar. We do want to share some final additional resources, and then at the end, if there's time, we'll do a few more questions. But for the priority indicators that were identified by the Food and Nutrition Service, there is an optional reporting form that states can use. There's a template that's posted on the SNAP-Ed Connection. So you can go and visit the SNAP-Ed Connection website to see where there's that template that you can download to complete. And this would be an optional template that states can use when reporting results to FNS for their FY17 annual report. In some cases, states that are already doing work using the framework, they could also report those results in FY16. We also want to ensure that there's still lots of questions coming in about the framework. We do have a single email box for questions about the use of the evaluation framework or interpretive guide. So we do encourage you to send those questions to this box. We also encourage you to continue to visit the SNAP-Ed Connection and to sign up for email updates when new resources are available. We also created an information badge for states and partners to put onto their own website, social media, and email signatures that promote the use of the evaluation framework and interpretive guide. We're not going to have time to go into detail on these, but just some key resources that were mentioned on today's call. For states that are interested in PEARS, PEARS is a reporting tool, a management information system that was developed by Kansas State University in partnership with the FNS Mountain Plains region led by Star Morrison. So you can visit the PEARS website for more information about their tool. Within the Southeast region, there is a learning community that's led by the Public Health Institute Center for Nutrition and Wellness in partnership with the Southeast region and with support from Veronica Bryant in the region, as well as Laura Kettle-Kahn with CDC. They've also created a simple tool that can be used for tracking the behavioral outcomes in the medium-term indicators. Then we have other tools, including the Community Commons online data mapping tool that has information about SNAP-Ed related indicators in partnership with the University of Missouri. CDC has the Data Trends and Map website with information about state-specific rates for all of our population results indicators. We also invite participants to become framework ambassadors. So if you're really excited about the framework, we see lots of questions coming in. If you want to learn more about the language of the framework, speak with confidence and give presentations to partners within your states, particularly useful for members of state nutrition action councils, we do encourage you to sign up to be part of a 5-hour virtual training. You can sign up by contacting the SNAP-Ed Evaluation Framework at fns.usda.gov. And then also some final resources, as Jeannie mentioned, on the SNAP-Ed-PSE website, created by the Regional Nutrition Education Center of Excellence, and also the Southern Region Center of Excellence in Nutrition Education and Obesity Prevention is creating a new SNAP-Ed interactive version of the toolkit, as well as an interactive version of the framework. So it's not currently available, but it will be available soon, which will be a great resource in addition to the SNAP-Ed Connection. And we want to close with just to highlight some upcoming events. So the next webinar hosted by NCORE focuses on evaluating healthcare community collaborations through partnerships with hospital-based programs. So some great speakers that are lined up for September 14th. So you can sign up at the NCORE website. And then also a reminder, as part of National Childhood Obesity Awareness Month, we also encourage you to participate in the Thunderclap. You can join the Thunderclap and sign up in the box on the right of your screen that says Thunderclap. So again, for any further questions about the webinar, you can contact the NCORE Coordinating Center. And again, for questions about the framework specifically, you can contact the new SNAP-Ed Evaluation Framework mailbox. Ooh, that was a lot. Again, you can go on the NCORE website and download the NCORE webinars, both the previous one as well as the one for today when the recording is available. And again, we want to thank everyone that's been part of this process. It really does take a national village to create and use an evaluation framework. So many of the partners who made this possible, we want to thank them. And I think we might have maybe, if people want to stay on the line for a few more minutes, I think we can take a few more questions. And we do remind you to mute your lines if you were if you're not speaking. So please put those phones on mute. So we're going to take a few more questions. So this is for both Heidi and for Lauren. So you described direct education surveys. Can you talk about, have any of those surveys been validated? And what guidelines do you provide to your partners about the direct education series used with pre and post tests? For example, how many lessons or hours of education generally take place for the administration of pre and post tests? So Lauren or Heidi, if you want to take that one.
This is Heidi. They are validated. We have actually used the FNAP behavior checklist we've shortened it, condensed it, but we used that. And so that has been validated. We also, when we give it to our NEAs, we don't have partners. We just work with one state agency, implementing agency in Utah. And when we give it to our NEAs, they are told to give them every time they teach. So then we can actually track how many lessons that person has had and even potentially see the difference in their behavior over 6 periods of lessons. And then for the follow-up, we hope that they have taken a 6-session series, and we have that. Also, we have a little card punch card where they keep track of that.
And this is Lauren. For the impact outcome evaluation of direct education, in the past, there have been guidelines that class series, that there had to be a 5-series, 5-course series for classes. We actually, for this year or for the next, or for coming up for 2017, suspended that requirement for it to be a 5-class series, just based on some feedback we got from folks that there were some curricula that were, on approved lists and were evidence-based that didn't require 5 classes, and that it was harder for some populations to get 5 classes. So for 2017, that won't be a requirement, but again, people will much as Heidi was saying, people will complete reports that tell us how many lessons were implemented and the duration of those lessons, so we'll have that information.
Great, thank you, Lauren. So this question is for Jeannie. So in looking at the flow chart, we have in the SNAP-Ed evaluation framework, we have changes at environmental settings at the sites and organizations, and we also have changes at the sectors level, which includes large-scale systems at the community, village, state, tribal, or territorial level. Can you use that flow chart for both changes in settings as well as changes in communities and states?
Yes, it can be scaled down or up. As I said before, we used it with a setting level at the preschools on their wellness policy implementation. But it's also been used, we did with the non-communicable disease coalitions, and use that type of STAME framework looking at it at a jurisdiction, in that case, a jurisdiction level. So it can be scaled up or down. In other words, you just look at as a group, and that's kind of the reason why we're coming up with the Readiness to Collaborate tool, because we figure it would be more beneficial to look at it from the collectives or the collaboratives' ability and readiness than just one group within that collaborative.
Great, thank you. Then there was also some questions about the PEARS system. So the question is related to when will the PSE, or Policy Systems and Environmental Change module, be launched as part of PEARS. And there's actually, it's great, there's some dialogue going on in the chat feature. So I'm just going to share that the team at Kansas State OEIE said that the PEARS PSE evaluation tool will be launched within the next couple of weeks. They've been working with the Nutrition Policy Institute of California and other stakeholders in the Mountain Plains region to develop the data collection tool. And the PEARS PSE tool will gather information related to needs and readiness, effectiveness of PSE work at both the environmental and individual level, program recognition and media coverage, and sustainability. So the PEARS PSE tool aligns perfectly with all of the environmental settings indicators within the framework. So it's great to have that information from the Kansas State team. We had another question related to focus groups, so this is for Heidi. So the question was related to, are your focus group questions available for others to use?
Yes, we can share them. We were able to get some of the questions from Montana and also some from one of the Dakotas, North Dakota or South Dakota, I can't remember, sorry. Yes, but we can share them.
Great. Then we had another question. This is for Lauren. Lauren, can you explain why you created a theory of change model? Can you talk more about the development of the theory of change model?
Sorry, I was unmuting myself. Yes, so as the group was working together, our state work group of all of the implementing agencies, we were looking at, trying to develop a shared evaluation plan, looking at the evaluation framework, looking at the kinds of work that everyone was doing, and it seemed to us that it made sense to develop a model for what we anticipated what this work would look like. So what do we anticipate? What kinds of things would happen? What would we be doing? What were the approaches we'd be taking? And what kinds of changes would we anticipate happening from that? So we're really using the theory of change model to help us develop the evaluation questions. That's sort of where we are right now, is we developed the model, we developed a series of state goals and objectives which are tied to this model, and then we're in the process right now of developing shared evaluation questions, which again will be derived from using this model of change, or this theory of change model, to guide the kinds of evaluation questions that we will seek to develop a methodology to evaluate across the state, across all of the implementing agencies.
Great, thank you, Lauren. And then we're going to do one final question, and this is for all of you. There are questions related to that you provided examples of tools for adults. Can you talk about any tools that you've, survey or data collection tools that you've used for children and youth?
So I know in California we have both a youth survey and a high school survey that are used in the impact outcome evaluations of direct education, and those are tools that are, so I would have to check for sure with our project coordinators on this, but I believe that there are just two tools available that we use for that, both a high school survey and a youth survey, that are used for the pre-post questionnaires.
And in Utah, we do a parent survey, so the youth take home a survey to their parents that from the schools. They take them home and then they bring them back for us.
Great. Well, thank you, everyone, for staying over time. There's so much excitement. We could probably just have this go for a few more hours, but people would probably kick me out of here. So again, all of the questions will be answered, and they will be posted on the NCORE website. If you have any additional questions, please start sending those into the SNAP-Ed Evaluation Framework mailbox. I also want to, again, thank all of our speakers. They've shared excellent stories, inspiration, as well as practical tools and strategies that can be used. So before thinking about creating something new, reach out to the speakers, reach out to your colleagues. Chances are something's already been created and tested and validated for the SNAP-Ed eligible and related low-income audiences. So before you do sign off, we do want to remind you to take a moment to complete the brief 7-question survey. As part of continuous program improvement, your responses will help to shape future webinars and maximize your time in the future. So we'll switch over to the feedback form now, and you can provide your input directly into the screen and hit submit. Again, thank you so much for joining us. Thanks to all of our speakers, great presentations. Thanks to everyone for all of your excellent work. So have a good night. Thank you.